Hello, and welcome to today's session, that Disease Management Advancements in Diabetic Kidney Disease Treatment. I'm Jonathan Traylor, an AAKP Ambassador and current transplant patient recipient with prior experience on both in-center and home dialysis. With a professional career experience in technology, website design, and social media, I use my skills and personal story to give encouragement and hope to those that are suffering with kidney disease. With a passion for all things kidney, I know my focus on and my efforts on advocating for organ donation for my fellow kidney warriors. I am involved with AAKP because with over 50 years experience with advocacy for kidney patients, it was a no-brainer for me to join the AAKP and stand with them as an ambassador. I represent AAKP as an ambassador. I've been involved with the RUOK 5.1 Potassium, and I've also done some walks for the AAKP to raise funding for kidney patients and the AAKP. It is my great honor to host this session on advancements in diabetic kidney disease. Diabetes is one of the most leading causes of kidney disease, and nearly 40% of individuals in the U.S. living with type 2 diabetes will likely develop chronic kidney disease. Substantial medical advancements are recently being made in this space, and these treatments represent hope for kidney patient consumers. And their decade-long demand for more innovations to help slow the impact of CKD associated with type 2 diabetes. Diabetic kidney disease has been on the forefront of all AAKP's major events for over the last 3 years. It is with that said that I am pleased to introduce our session speaker, Dr. Stephen Fadem, Chair of the AAKP Medical Advisory Board and Clinical Professor of Medicine at the Baylor College of Medicine, Section of Nephrology. As a CKD patient himself, Dr. Fadem has an extensive and decorated medical career. He has participated heavily in the development and revisions of numerous AAKP patient education materials, including the AAKP Patient Plan series and the AAKP Kidney Beginnings, a patient's guide to living with reduced kidney function. He is also the recipient of the AAKP Visionary Award, the AAKP Dr. Peter London Award, and the AAKP Medal of Excellence Award in the physicians category, and a 2020 recipient of the highly regarded Presidential Volunteer Service Award by the AAKP for his exceptional efforts supporting ongoing advocacy and response to the COVID-19 pandemic. Dr. Fadem is also listed in America's Top Doctors and serves as both editor of AAKP Renal Life magazine and historian for AAKP. I could continue on and on about Dr. Fadem's dedication to the kidney patient community, but I'll pause and welcome him to the floor to give his presentation.
Hello, everybody, and welcome to AAKP. I'm Dr. Fadem, and I'm going to talk with you today about diabetic nephropathy. The title of this presentation is Staying Healthy with Diabetes. Much of the information that I will be discussing is taken from Issues in Kidney Disease and Staying Healthy with Kidney Disease. These are two books that I have been involved in, and they are both in press right now. The objectives of this talk are to make sure that you are familiar with the mechanisms of disease. This is very important. I cannot ask you to get onto a special diet and take medications if you don't know why. The next is to help you to understand and to review the natural history and timeline of diabetes and diabetic nephropathy. I think it's important to know what to expect with any medical condition. And finally, we want to discuss and emphasize the principles of management so that we can understand better how to take care of ourselves, not just to delay this disease and not just to delay its involvement on the kidneys, to make sure that we have a comfortable, healthy, and happy lifestyle. We cannot manage a medical condition if it's a chore or a burden. It has to be part of our lifestyle, and that's our goal with this talk. Some housekeeping. I would like to disclose that I'm a principal investigator for Reata and for Ardelyx, which means I do clinical research. I'm also a member of the National Quality Forum and on their advisory committee for diabetes, which means that I go to committees and listen to top-notch colleagues and help them make some important decisions that will maybe help us to care better for our patients and even ourselves. What are the mechanisms of disease? The first mechanism is hyperglycemia, or high blood sugar. The next mechanism is hypertension, or pressure against the blood vessel walls. And the third mechanism is inflammation. That process that we all use to fight disease sometimes damages our own body tissues. This is a normal filter. This is what the kidney looks like if you look down inside of a microscope and you blow the picture up and make it very, very large. You'll see an artery going into a sac. And of course, this is a slice. So you have to use your imagination that this is really a ball, but you have an artery going into a sac, and that artery is going to wind upon itself, and it's going to become a bundle of capillaries, and then it's going to exit. Where it goes in is called the afferent arteriole, and where it comes out is the efferent arteriole. Now, while that blood vessel, that capillary, is inside that sac, it is very, very busy. The blood running through that sac and through that capillary is filtered, which means the proteins and the blood cells, much of the fluid and much of the minerals stay behind. But some of the minerals and some of the toxins are filtered into that sac. And they're drained off through the proximal tubule, which you see on the right-hand side. Now, in the middle is this area, and of course, middle, meso, is called the mesangium. This middle portion is a bunch of cells that create a matrix, and they do the housekeeping. They make sure that the capillary and that basement membrane that surrounds them are in good shape. Now, that membrane has a cell, and that cell has foot processes. And because it has foot processes, we call that the podocyte. So what happens to this glomerulus, this sac, if there's a high blood sugar? Well, the high blood sugar turns on the Renin-Angiotensin System. This is a group of hormones in the body. And these hormones activate blood vessels, and they cause the efferent arteriole that leaves the kidney to tighten up. This is a reflex that happens because angiotensin is supposed to help us during emergencies if we get too dehydrated or even if we hemorrhage. So this blood vessel tightens up, and that instantly increases the filtration pressure on that capillary, and that can damage it. The second thing it does is it stimulates the mesangial cell, and the sugar that stimulates the angiotensin stimulates the mesangial cell to make these products. One's called transforming growth factor beta, and that has a complicated pathway, but what it does is it turns on the DNA that makes collagen. Collagen becomes scar tissue. So what happens is you end up with a bunch of scar tissue inside this very delicate filter. Now, other things take place too, and we're going to talk about those. The next thing that happens beside high blood sugar is high blood pressure or hypertension. Now, high blood pressure does a similar thing. When you have a high blood pressure, it causes the flow to increase into the afferent arteriole. And this is causing the afferent arteriole to react and constrict. And that's good if it does that. But in the meantime, it's going to cause a lot of sodium to go to the macula densa. And that's an area that runs between the afferent and the efferent arteriole, the AA and the EA. That's called the MD, macula densa. And that's going to turn on the macula densa, and it's going to cause a reaction. Now, if the reaction causes the blood vessel going into the kidney to narrow, that's a good thing, but that's not what happens. It causes that blood vessel to get bigger and bigger, so more blood goes into the afferent arteriole. And what do you think happens? Like the efferent arteriole getting narrowed, too much blood going into the afferent arteriole causes pressure, increased pressure on the capillary, which damages it. So that's the second way that diabetes, and also the way that high blood pressure, damages the filter. Now, there's a whole lot of other stuff that happens. One thing is nitric oxide. Nitric oxide is a chemical that lines the blood vessel walls. In 2010, scientists won the Nobel Prize for figuring all of this out. But about 100 years ago, one of the great scientists, a guy named Alfred Nobel, figured out that nitrogen was an essential compound to help ignite dynamite, nitroglycerin. People even knew back then that it could not only cause an explosion, but it might help to treat certain diseases. And minor amounts of nitroglycerin, not enough to blow us up, but enough to give us a way to dilate our blood vessels, has been used for years to treat angina. But this type of nitric oxide is very important because if you don't have it, if inflammation knocks it out, your blood vessels constrict. Now, what do you think happens when the blood vessels constrict? Your blood pressure goes up. That's what happens, and you have high blood pressure. And so high blood pressure can damage blood vessels. That's why we want to be very careful to keep our system in good control. So the final mechanism, and believe it or not, there's only 3 major mechanisms that we need to talk about, is inflammation. Now, inflammation, that's what happens when you have an infection. When you get a cold, you have an inflammation, an inflammatory reaction. When people had COVID, they had an inflammatory reaction. When you have a kidney infection or pneumonia, you have an inflammatory reaction. And high blood sugar also causes this inflammatory reaction. Now, when you have an inflammatory reaction, it causes the release of these products that you see over on the right called cytokines. These are hormones that come out of cells, and they have all these different actions on the body. And some of the actions stimulate a way that you can make the inflammation worse, because by making the inflammation worse, your body's creating antibodies to fight infections. And some of them actually can help control the inflammation. Now, one of the things that happens with inflammations is that you increase free radicals. One reason why is that you need those free radicals to fight the infection because they have a hot oxygen in them. They have oxygen with hot electrons that can basically fight bacteria and viruses. Unfortunately, though, your body needs more energy. There might be a mismatch between the oxygen and the fuel that goes into the energy packets in the body, the little batteries that we call mitochondria. And if you have that mismatch, you have free electrons, and they can cause a lot of damage because then they start attacking the cells and the parts of the cells that are necessary for our survival. So how does this fit in with high blood sugar? Well, high blood sugar increases this oxidation product that has to do with the nitric oxide, so has to do with decreasing nitric oxide. It interferes with the mitochondria, so you have too much oxygen particles or oxygen electrons and oxidative stress. It releases angiotensin, which interferes with the blood vessels, and it causes advanced glycation end products, which stimulate collagen. And it causes changes in how the cells repair themselves. And it actually can interfere with the cell's ability to repair itself. If it helps the cell to repair itself, the cells can drop out and they reduce the inflammation. But when you're talking about a podocyte, you only have so many podocytes in your body. And once you lose your podocytes, you don't have any more. So if the podocytes drop out, that's not good because that leads to glomerular damage. That happens to all of us as we age. So what is the natural history of diabetes? Well, you have a long honeymoon period, luckily. During that period, you hyperfilter. Hyperfiltering is not a good thing. It means that sugar is causing that blood vessel to be dilated, and it's causing too much blood to go into the filter. And it takes a long time, but over a period of time, it damages that filter. Once it starts damaging it, we know it because small amounts of protein leak across that filter. And we call that microalbuminuria. And this progresses, but it progresses depending on you. If you do a super job of taking care of yourself, and if you have the right genes, you may delay the progression of the disease. However, in some situations, if you're not as careful, the disease can accelerate. The kidney function, when it declines, it causes several problems. It causes protein in the urine. It causes metabolic acidosis, causes anemia, causes a high potassium. It decreases albumin, and it increases the parathyroid hormone levels. These are all things that happen inside the body. They can cause a lot of damage. You may not understand every one of these terms right now, but we will be explaining them because we want to explain how to control them. Finally, if everything goes wrong after 15 or so years, your kidneys completely fail and you need either a transplant, peritoneal dialysis, or hemodialysis. So let's talk about management. The first thing to talk about with management is to talk about high blood sugars, because that's one of the main problems. So how do we control the blood sugar? Well, nowadays we have a little device that you can stick onto your arm that can constantly control it through your iPhone or some other device, and you can see exactly what your blood sugar is. Does intensive therapy work? Well, there have been several trials all the way back since 1983 that show that it will reduce cardiac events and the protein in the urine. However, there's a downside, because if the blood sugars get too low, they can faint, they can lose their appetite, they can wreck their cars. So the Veterans Hospital did a very extensive study on some of us older people, and they found that if you get a hemoglobin A1C that drops too low, that doesn't seem to improve the mortality rate. But glucose monitoring does help us. It helps us know what we're doing. And if you can control the blood sugars very, very well, you can get them to be a little bit lower. And at the same time, you can control some of the disturbing side effects, such as peripheral neuropathy. So this is what the continuous glucose monitor looks like. Now, I didn't have one and I wasn't around a patient at this time, so I shamelessly stole this from the internet. But this is what this would look like, and it would look like this on your arm, and you would change it periodically, and then you could keep up with your blood sugars using either the device that comes with the monitor, or I'm sure there's an app and you can keep a record of this on your iPhone or smartphone. Let's talk about the second mechanism and what we're going to do to treat it, blood pressure. Well, a long time ago, there was a very extensive study that was called the Modification of Diet and Renal Disease Study, and they looked at everything they could with diets to control the progression of kidney disease. And they came up with several facts beside the diet. They came up with the idea that if you do a really good job of controlling your blood pressure, it helps decrease proteinuria. So if you have a lot of protein in the urine, you need to do a very good job of controlling your blood pressure to help to decrease that protein in the urine. The next thing is that just because you control the blood pressure doesn't mean that you reverse kidney disease, because there's been a lot of damage in scar tissue, and they may not automatically go away just because you're keeping the blood pressure under control. In fact, since 1966, there have been 123 trials up to 2015. They looked at 613,815 subjects. They found that the risk of cardiovascular events declined and that all-cause mortality was reduced by 13%. So you should lower the blood pressure. But what they did find, unfortunately, as well, was that the kidney function still did not get better. Now, it got worse if your blood pressure was too high. But they also found that in the older population, there was a reduction in death and stroke, even if the kidneys didn't get better. So lately, we're recommending that you do a good job of controlling your blood pressure. And these are our suggestions. First of all, control the blood pressure to 125/75 if you have protein in the urine. If you have just plain old chronic kidney disease, there are now new guidelines that tell us to control the blood pressure even lower. What does that mean? It means that we want to go even lower with our blood pressure. Now, if you're not at risk, you really don't need to go below 140/90, according to some studies. But lately, they're saying you should try to go a little bit lower. If you have a high risk, you should go maybe down to 120. The problem is that if you go too low, you have to be very accurate with how you measure the blood pressure because you don't want to overshoot it. And then the important message also is to remember, if you do nothing, if you ignore your blood pressure, you don't do anything, you don't watch your diet, your blood pressure is going to be too high and it's going to damage your kidneys. So, what are some other principles of management? Well, remember, there were a lot of things that happened when the kidneys failed, and we wanted to stop and prevent those. So the first is to block that angiotensin 2. And remember that. That's the thing that's causing the blood vessels to dilate, or actually it's causing them not to dilate. It's causing them to constrict. So we want to give a medicine that will cause them to dilate. This is the efferent arteriole. We want it to dilate back up so that it will take the pressure off the filter. So we use an ACE inhibitor or an angiotensin receptor blocker. And I bet you're very familiar with these medications. I wouldn't be surprised if most of the people with chronic kidney disease in this audience are on one of those medications. If your kidney function is good, if you have at least stage 3 kidney disease, you can be on metformin. Metformin is a very good drug to lower the blood sugar. It takes the pressure off the pancreas, and it also helps with some other mechanisms that will help you to stay very healthy. And it'll be in this book that we're publishing called Staying Healthy with Kidney Disease. And we do talk about metformin in that book. And it's a very good product if you can take it. The next thing is Sglt2 inhibition, because SGLT1 and SGLT2, sodium glucose transporters, these transport mechanisms can cause too much damage inside the kidneys. They trick the macula densa into thinking there's too much sodium, and that can cause a lot of problems. So you want to inhibit that, and you don't want to have your macula densa to cause the body to retain that sodium. You want it to get rid of that sodium. So what you want is you want that inhibitor, because it'll help get rid of that extra sodium, and it helps get rid of sugar, and it takes a lot of pressure out of the kidney. So they're finding the SGLT2 inhibitors, and you're probably familiar with some of these drugs. They're gonna be very helpful to you. And there have been several studies that show that. Dapagliflozin, empagliflozin, all of these types of drugs are going to be shown to be helpful, but you can't take those if you have even some types of stage 3 kidney disease. You have to watch your kidney disease pretty carefully. And if you do have bad kidney disease, you're not supposed to be on these drugs. The next is Feneron. Now, Feneron just came out. There were some beautiful papers written on it, and it works on that renin-angiotensin aldosterone mechanism. So it too helps the kidney, but the side effect of the earlier drugs that it's replacing are that they cause the high potassium. Remember, we talked about potassium as being one of the problems. So we want to keep that potassium under control. And one of the ways is Feneron. The other is Patiroma and zirconium. Those two can help to lower the potassium. If you have kidney disease, you want to keep your potassium under control. And the next thing is bardoxolone. Now, bardoxolone is still being investigated, so we can't really brag about it or not brag about it right now because the investigations are ongoing. But we might find that bardoxolone helps to reduce inflammation. Now, there's something else I didn't mention, and that is acidosis. So we're going to talk about that now. First of all, let's review. What do we know about the diabetic kidney? We know that reactive oxygen species and inflammation expand that matrix area, the housekeeping part of the kidney, and cause scar tissue to form. And this is all related to high blood sugar. We know that restricting sodium will help lower the mortality rate because lowering the blood pressure will. We know that fat is bad for us. It's metabolized by macrophages. It's eaten up by inflammatory cells, and it stimulates those inflammatory cells. And unfortunately, they die and they become calcified. We know that phosphorus and calcium damage blood vessels, and when they do, they make the blood vessels very stiff. And we also know that very, very early in kidney disease, acids build up in the body. They are very damaging to the cells. So what do we want to do? We want to control our diets, maybe take bicarbonate tablets so that we can control metabolic acidosis. Research is showing that staying on a diet which is high in fruits and vegetables, or taking a bicarbonate tablet that you can take over the counter 2 to 3 times a day, you can help protect your body from that acidosis. The next thing we know is that when those autoregulatory mechanisms, that feedback mechanism, fails because of constant pressure against the kidney, your kidney is going to lose extra protein, and the high salt is going to cause the damage to the filters that's going to cause the filters to die, to actually become obliterated. And we also know that if you're over your body mass index and you have high blood pressure and you have high blood sugar, it's going to promote hyperfiltration and inflammation. So we have an opportunity to try to control our blood pressure and control our blood sugars and control our body mass index. So what are the dietary principles? This is very, very, very important. Your doctor sees you for 15 minutes, but what you do is 24/7. You're getting a good night's sleep, you're exercising, and then you have to eat the right kinds of foods. So you want to eat more fruits and vegetables. You want to eat less animal fats and animal proteins. You definitely want to cut down on the proteins. And you want to eat plant-based foods because the proteins in the plant-based foods are harder to digest. So you get more antioxidants, more vitamins, and more fiber from the plants. You get more bang for your buck. Next, you want to watch your sodium. Now, who says watch your sodium? Well, that's a joke. Who says watch your sodium? The World Health Organization. And they're telling everybody to do that because, believe it or not, high blood pressure is a big problem in developing countries. So the WHO has recommended controlling our sodium to 2 grams a day. So that's who said it. Who? Next is metabolic acidosis. Now, a lot of research that came out of Texas and where I'm from and several other places have suggested that if we can control that metabolic acidosis very, very early in kidney disease, when it first starts, we're way ahead of the game. The other thing we need to do is control phosphorus. Now, when Mr. Nobel was working on gunpowder and things like that, people were also figuring out that phosphorus was a very good explosive and it was good for ammunitions. In fact, it was so effective that they actually outlawed it for ammunitions. Now, you need phosphorus in your body. In fact, phosphorus in your body is a very important source of energy. But if you have too much phosphorus in your body, it can damage your bones and it can damage your blood vessels. In fact, it can turn your blood vessels into bones. So you have to be careful with your dietary phosphorus intake. And finally, potassium. It's very important that we watch the potassium in our diet. We don't want to eat too much citrus, too many bananas. And if it looks like we're headed in the wrong track, we need to discuss this with our physicians. Some of the medications, the ACEs and the ARBs, Feneron, can actually raise our potassium. We may need to be on Patty Romer or zirconium. So what about lifestyle? We talked about diet. There's more to diet. Cigarette smoking. Now, some people still smoke cigarettes. And some people roll their own, like this guy. He seems quite mellow. But some people buy them in the store and pay money for them, and I don't know why, but they do it, and it's very damaging to their lungs, and it stimulates inflammation, and it's very damaging to the kidneys because inflammation is one of the things that damages the kidneys. The next thing is body mass index. The reason we want to lower our body mass index is because oxidative stress is lowered when we lower the body mass index, and it also helps our kidneys. It reduces hyperfiltration. And the next thing we want to do is exercise. Exercising at least 3 times a week lowers that hemoglobin A1C, controls our blood sugars, reduces the risk of falling, decreases inflammation, and it makes our bones stronger. It helps our bones. So we definitely want to exercise. And there's me exercising, and I do it a lot. To me, exercise, I even take exercise snacks where when I have nothing else to do, I'll do some push-ups against the sides of something, or I'll do squats or something to try to stay in good shape. And the reason I do is because I've looked at people that are my age and older and even younger, and if they were not exercising, those muscles deteriorate. But they don't have to deteriorate. They'll stay really, really strong if you keep exercising them. And they'll keep your bones strong, and they'll help you a lot. So the best way to exercise is with these little resistance bands that you can buy at Target, or you can get them online for $12, or you can just walk up the steps, walk down the steps. I recommend a handrail because as we get older, our balance isn't as good. But this will preserve our gluteus maximus muscle. It's the biggest muscle in our body. We certainly don't want anything to happen to that. We don't want anything to happen to our biceps or our triceps. So you hold on to that handrail, and when you go down the stairs, you sort of hop a little bit, and that puts pressure on your bones to keep your bones strong. So we could talk for hours about this, but we're not going to, because I want to give you a chance to ask me some questions, or maybe even answer my questions. Who knows? So this is what the elastic bands look like. I believe I bought these at Target. They're simple to use, inexpensive. You can vary them. They come in all different sizes and shapes. And so if you get more advanced, you use the different colored ones. You can take them anywhere. You can travel with them. It's a great support system. Everybody uses them, so you can ask anyone. They'll give you exercises, tell you what to do, and they give you that resistance that helps keep your muscles strong. Well, that wraps it up. The take-home messages are that there's newer medicines like the Sglt2 inhibitors and Feneron, which can preserve kidney function. You can control your diabetes and blood pressure. You can take ABEs and ARBs to help to control your diabetes. Your diet is very, very important. You definitely want to restrict your salt, eat more fruits and vegetables, and lifestyle makes a difference. Reduce that BMI, quit smoking those cigarettes if you smoke, and exercise. And I would like to thank you for spending some time with me today talking about how we can stay healthy with diabetes. I hope that this was informative, and I hope that you got something out of this.
Thank you, Dr. Fadem, for an informative presentation. It is always a pleasure having you to join us.